I'll usually review with every patient the option of from the more aggressive to the less aggressive to the minimally invasive. One of the nice things about the Lupo Center is we have a number of different lasers. We don't just have one laser and try to fit a square peg into a round hole. We have the CO2 resurfacing laser, which is the most aggressive one. I would say the next one would be the Fraxel Dual. And then again, you can take the Fraxel Dual and you can do it more aggressively or less aggressively. And then we have other lasers. We have the CoolTouch laser. We have XLV. We have a non-laser light device called the IPL. We have radiofrequency microneedling. We do regular microneedling. We do light chemical peels, and we do something called dermal infusion, which is sort of a combination between microdermabrasion and a light chemical peel. And the spectrum is so varied that a patient can decide, do I want to have one treatment of a more aggressive laser, or do I want to do a series of lesser lasers intensity? Clear and Brilliant, another one that is a lesser aggressive Fraxel, but the patient would need a series of them. But the trade-off is there's no downtime. We cherry pick, we consult with the patient, we give them their options, the pros and cons of each of those options, and then the patient can make a truly informed decision with a lot of options. And we do our best to really guide the patient and not make their choice for them, but we do our best to guide them to our number one recommendation. And then if they want to go with something different than that, we try to make an understanding of why we made the primary recommendation. We always listen to the patients. This is not a one-size-fits-all discussion. And the key is to be on the same wavelength with the doctor. Make sure the doctor understands your needs, understands how to improve what you want to have improved, and also how to make sure that you get the best results. The experience of the physician recognizes the complication and treats it early and in the appropriate manner to mitigate any complications from the complication. So some of the times I've seen patients who have seen by non-board certified doctors, and they had complications that became a problem because the doctor didn't have the experience to understand that the patient was having a complication and how to treat it early on and mitigate it. It's the understanding of the device, understanding of how skin heals, and experience handling complications that really separate. And what's important is the doctor more so than the device itself.